Great. So welcome everyone to the Ontario Nurses for the Environment Interest Group's June quarterly meeting. Just starting off with land acknowledgement. I mentioned just before this to the people here that I'm coming from the Haldeman Tract, which is also known as Waterloo area, and it is the traditional territory of the Haudenosaunee, Anishinaabe, and Neutral peoples. And this actually relates to some of these First Nations groups. I was learning with Environmental Defense and Michelle Woodhouse, who works with them as one of their program directors, about Line 5, which is something that hasn't been in the media much, but has been in the media a bit more recently, as they've taken the issue of a gas pipeline that moves through I think it's the Mackinac Strait. It moves between Great Lakes through to Southern Ontario. Oh, can you move back, Rob? And I included this in one of your emails out to members, just a quick link to it because I just wanted to bring your attention to it. There's even very recent news. They've brought the issue to the UN, and it's really, the government of Canada has actually been pushing up against some First Nations, not only in Canada, but in Michigan, where they have acknowledged that this is an Indigenous sovereignty issue and is calling for, and the UN is calling for Canada to re-examine its support for this pipeline, given the push from First Nations and the assertion of their sovereign rights to protect these waterways. So if you want to learn more about it, there's news in many places. Here's two options. One is from Environmental Defense on their site about Line 5, and then another one is through Turtle Island News, and there are many more. So take a look. The news has just been breaking in April and May of this year. A new push to get action. All right, great. Thanks, Rob. And now we'll go to the agenda. So I want to welcome you all here. Just want to see how many people we have. I don't have a great view here. 1 second. Maybe let's see. We have 9 participants. Maybe we actually have enough time to just do a quick hello from anyone who's able to. And maybe you just want to say a quick hi and something about what brings you here, like a sentence about what brings you here to this meeting tonight. And if it's obvious because you're an executive member, maybe you could kind of introduce your role in the ONEIG group. So I'll start first. I'm Jocelyn. I am one of the co-chairs, just finishing my 2-year term that'll finish at the AGM in September. I'm working with Rob here. And yeah, I've just been really loving being in this role, doing some of the work to facilitate the group's efforts to advocate and bring awareness to issues around the environment and health. I'm going to call people out because it's so much easier that way. So I'll go next to Rob.
Hey everybody, I'm Rob. I'm in Ottawa. I'm working in community nursing right now in Ottawa. Some of the things that I'm working on with ONEIG, well, just the regular ONEIG day-to-day stuff, even though Justin's far superior at that than I am. And as well, hoping to get something started on healthcare supply chain, greening our healthcare supply chain, and I'm trying to get stuff together for COP28 as well. And today I went mountain biking during our PD day with our kids, but it is very, very smoky here in Ottawa right now. All the smoke coming down from northern Quebec. It's very smoky. So we went very slowly as we biked. We didn't go very hard.
Thanks, Rob. Yeah, we noticed that in the weather forecast today too, even over here. Thanks. I was hoping to hear next from Hilda.
And Rob, just talking about air quality, I was part of the Air Quality Health Index team right along. And so I've gotten a notice today about the air quality in Toronto being bad. So the smoke is just covering everything. I'm also a member of the founding executive of ONEIG, and right now I'm quite pleased to be able to start working with the Canadian Association of Nurses for the Environment for a memorandum of understanding between ONEIG and Kane. And so it's quite exciting. And also I'm quite excited to be starting to work with Parks Canada to try and put something in place about parks and how important the nature prescription is that Dr. Melissa Lim wrote about.
Amazing. Thanks so much, Hilda. Yeah, it's been incredible having you being a connection between these two big groups too. Next I have on my list, Victoria.
Evening. I'm Victoria. I'm your finance exec. I am just going day by day right now and trying to live life right now. I'll be 34 weeks pregnant on Wednesday. And I am trying to multitask many different aspects of life right now with a new job, new baby, first one, many ONEIG tasks at hand. But it's great. It's fun. It's life, right? Yeah.
That's amazing. Thanks so much, Victoria. I have Arpita, I'm guessing because you put it in your chat that you aren't able to maybe speak, but welcome. I see you're a nursing student and you just joined in September and came along with us in ONEIG. So yeah, we're so happy to have you here. And maybe we'll hear next from Emma.
Hi everyone, I'm Emma. I am the student liaison, though I will be giving up student status shortly, which is very exciting. So unfortunately, that means I haven't been quite as active in the last couple of months as I would like to be, but I'm hoping that over the summer, I'll be able to kind of hop on some of our bigger projects and kind of provide more of a background assistance role in keeping some of those moving along.
That sounds incredible. Thanks, Emma. It's so nice to have you in that role. It's going to be, I mean, great to have you also to mentor the next person who joins us as a student. And congrats on getting so close to, yeah, being out of that part of your life. I haven't heard yet from Kathleen. Welcome, Kathleen.
Hi, everyone. Yeah, I'm Kathleen. I am in Durham chapter, and I'm actually one of the board members. And so I've always loved your group and the interest group and want to always learn more. So I was like, I've enjoyed your events and learning. So I thought I would hop on tonight and see what you guys are talking about, because it popped up. I think it popped up, either I saw it on social media or probably Twitter, because I don't know if I'm on your email group. But yeah, I think you guys are doing a wonderful job, and I just want to congratulate you guys on really advocating and pushing for issues. I know in Durham region, there's some big groups that are pushing about the Greenbelt expansion. So I try to reshare and obviously be an ally and help speak out about some of that. So yeah, I'm just happy to join your group tonight. Thanks.
That's awesome. Thank you so much for coming along, Kathleen. Let's see, what have I missed now? I kind of got them out of order. Things switched around a bit. Sarah, hey, welcome.
Hello, my name's Sarah. I live in Burlington and I work in the hospice in Oakville and also the hospice in Burlington. And this is my first meeting and I just wanted to see what it was all about. So thank you very much for having me.
Amazing. Thanks, Sarah. Glad you came along too. I think Arpita, to speak up if we're able to. You don't need to. I think Dominique, I don't think we heard from you, right?
No, I didn't.
Okay.
Hi guys, my name's Dominique. I'm one of the policy and political action execs alongside Olivia, but she couldn't make it tonight. Yeah, I joined ONEIG, I think it was right after graduation. So it's been almost 2-3 years now. Oh my gosh, it's been a while. But yeah, I'm very glad I've joined this group. Very, very welcoming, very wholesome group. And yeah, today was very sunny out and I volunteered in the garden today, did some watering, and yeah, it was very nice, very nice. So happy to have the spring weather coming in now. And summer weather, I guess. It's a little delayed.
That's amazing. Thanks, Dominique. Yeah, it's such a it's been really nice for getting outside for sure. Although I'm sure we all hope for maybe an overnight rain anytime now. And if you're living in
Yes.
Southern Ontario,
Yeah.
well, many places with the fires going on too, right?
Mhm.
So yeah, welcome everyone. I don't think I missed anyone. If I did, speak up because I did get out of order a bit, the way that things were rearranged. But yeah, welcome everyone. I'm so glad you came. We're going to talk about a couple of different things today. So we're going to just talk briefly about the survey that went out. I'm sure you probably got an email about it if you remember, and if not, it was just a quick member survey and also a way to gather some people's thoughts for an Earth Day video that was put together by Emma. So we'll talk about that briefly, and we're going to give you some updates, and we're going to talk about the resolutions. And if we have time, and even if we just have a little bit of time, I'll share just some updates about some issues happening in Ontario. So let's move on to the survey. And also I've just put in some pictures from the gardens, like just to make things interesting and hopefully brighten things up a little bit. So yeah, I can go to the next slide, Rob. Yeah, I don't have to worry about permissions when I've taken them, right? Okay, so this is the result from the feedback we got from our members. We had 14 responses. So it's not a huge turnout, but you don't expect a lot of turnout for these little surveys actually, but we got a few people who were interested in giving some feedback about a potential change to our name. And this is something that this is not the decider right here, but this is just some feedback that we can bring to our AGM where we may bring to the membership a potential name change. And the one that stood out was the first one here, and it's kind of hard to tell because it cuts it off. The first choice was ONE, like it to be ONE, Ontario Nurses for the Environment, and us to be known by that acronym. And Rob, like off the top of my head, I cannot remember all the rest of them, but I know you were a big part of it. You can see Ontario Nurses Committed to the Environment, and Ontario Nurses for the Environment Interest Group, I think is the one that follows up in the first choice category.
Do you know which the other one, the red one is?
I can't, that's the thing, I can't go back to it right now, but
I think the red one was Ontario Nurses for Environmental Health.
oh, okay. Yeah, I think you're right. I think you're right. So yeah, that's kind of how it ended up playing out. A lot of people, there are some people who decided not to give any feedback as well. That's too bad it came out like this, but most people, we'd at least have like a clear winner in this for this feedback, which was the one, Ontario Nurses for the Environment, that would just be ONE as an acronym. And then the next slide, if you can go to that, Rob, is the French feedback. And unfortunately, it kind of came up the same way. Let me see if I can figure out a way to bring up that content.
Is it like infirmière pour l'environnement?
Yeah, I need
Or
to.
infirmière de l'Ontario pour l'environnement?
That sounds perfect, Rob.
That does sound beautiful, doesn't it?
But is that it, or was it with the
I can bring it
environmental
up
health
really
added to it?
quickly. It isn't. I don't like doing this without having it in front of me because it's not fair to you guys. So let me bring that up right now. I have it here. Okay, so we have for this one here, the blue is infirmière, so it's like the masculine and feminine of nurse, de l'intérieur pour l'environnement, that's the blue.
Okay.
And the red is infirmière de l'Ontario pour la santé environnementale. And sorry, I'm butchering the pronunciation. The orange was infirmière de l'Ontario pour la santé planétaire, so for planetary health. So it has a little bit of a different meaning. And then green is abstain. So there's some people who, because they don't speak French, who abstained for that reason. Okay, and we also, but yeah, so that at least I had those ones in front of me. It's a little bit, well, it seems as though most people were kind of taking what would be pretty analogous to what ONE would stand for, or even what ONEIG stands for, which is Nurses of Ontario for the Environment. That's the translation for that one, and that's the blue. So most people chose that as a first choice. Although again, very small numbers here. We only have a few people, but that's what the feedback we were given came to. All right. Rob, you can move to the next one. Now, and I'm only gonna, this is like the last question. It was a really simple survey and we had 12 responses here. But they're actually, we had some little themes that were in there. People wanted to network and be with like-minded people, learn about environmental concerns, and they were just interested in the environment. And then some person put down that they joined ONEIG because we're awesome, which I had to include here because that's pretty fun and nice thing to say. Yeah, so we had some some good thoughts that we can build upon and kind of embed in some of our recruitment too, like just seeing the reasons why some people who are more engaged and willing to do the survey want to be part of this group. So that's pretty much it. And the video that I'll show in a little bit later, I'll just point you in that direction. I won't see it during this meeting. That Emma put together for Earth Day has some of those responses that people gave to about basically why it's important to invest in the planet, in the environment, which was the theme of Earth Day this year. Okay, so now updates. I'm going to do this part because our social media exec, Cleo, wasn't able to make it today. So she sent me these stats. We are having some new followers, which is great across all platforms. We had a lot of different page visits and likes. Our posts, we've been posting fairly frequently. So this is for the period of February to end of May, so 3 months. So, a few posts every week, which is pretty good. I know a couple of us dabble on Twitter as well to get things, to keep things moving and get things retweeted. We've had quite a bit of retweeting and mentions, 53 mentions on Twitter. So other groups are kind of connecting with us and we're building off each other, which is really great to see. That's what's going on social media. We can go to the next slide. Awesome. And Rob, I think you added to this one, right? Okay. Oh, was that you, Emma? Just wanted to double check.
Mostly just to kind of keep that in mind, because I know that COP is kind of our main priority because of the timeline. But I wanted this to kind of be brought up in some respect. Perfect. So I was just kind of wondering, the unit that I'm currently on as a student, I've heard some murmurings from some of the nurses that management is concerned with how much plastic waste they have as a unit. So I'm thinking if we're going to launch some kind of like a pilot project or feasibility study, this might be a unit that we could kind of trial a couple of things with or investigate trialing with when the time comes, if we're ready for it.
That's amazing. Great development. It really puts us in a good place.
And I also wondering if we wanted to connect with this group that's associated with the University of Toronto. It's the Sustainable Health System group. So what they did was they created scorecards that would evaluate how green or environmentally friendly different operating rooms are, give them a grade, and all that information is publicly available. So we can kind of look at what they've done, see what we can get, like see what works, what doesn't work, what we think would work for our idea for the reduction strategy. And I like their idea of kind of not naming and shaming, but maybe a more positive spin of naming and encouraging people to get better marks.
That sounds great.
On a similar idea, I had a meeting a couple months ago with some executives from L'Hôpital Montfort, and they were saying that it'd be interesting to put it in with the hospital accreditation process, both with Accreditation Canada and the ISO's standards. And a lot of hospitals really aim for those from the organizational level. And if we went it from that angle and had, because hospitals want to be considered exemplary or whatever, and if that was part of the criteria to get exemplary status, then we need to have a measure to be able to measure who gets who can actually get that level, but would be it the environmental scorecards or supply chain issues, etc. But going from an accreditation point of view.
That sounds great. Looks like we've got like a lot of directions to go in. And I think this is like kind of been chosen as a project that a lot of ONEIG members have been interested in over the years, and that we have a lot of interest in within our group. So we've got, we're gonna be moving forward on like having meetings and looking at what's out there. Some of the speakers at the event that the collaborative event we had last time we're talking about some of the work within Cascades and the Canadian Coalition for Healthcare Without Harm and things like that, like these some of the organizations doing, or sorry, Canadian Coalition for Green Healthcare, who've been doing some of the work too, and we can kind of bring that all together. Yeah, some great avenues to take. And then the next one, I don't think we've really talked too much about this, so I just wanted to bring that up, that I've been talking to RNAO head office about using the water position paper that we're really working on when we put forward a resolution to the head organization, RNAO, to take more action and advocacy for healthy waterways and access to drinking water and sanitation. And so that might be transformed into an academic paper. There's some buy-in from the policy leads at RNAO on that. So I'm gonna talk to them about that. And we had that call out, I think that some of you saw too. I think it's in the Critical Nursing Journal for papers on environment and climate. So we may go that way. And then Hilda was just talking about this as well, that we have this ongoing work that's happening with the Canadian Association for Nurses for the Environment, who and us, that we're going to try and talk about how we can build and formalize our relationship so we can work together more collaboratively. Oh, I see your mention here too, Kathleen, about, yeah, exactly, the waste in the hospitals. And that is something that people bring up so many times, and it connects with so many ecological issues, right? Between waste, pollution, climate. So yeah, it's been a big thing that keeps coming around in the years that I've been here with ONEIG. So I'm glad we're doing something and focusing the campaign in this direction.
Hilda.
And Emma, I think there was somebody at Mount Sinai in the OR at one point who was trying to get rid of some of the plastic waste and make the surgical packages more efficient. So I'm sure there's somebody still there in the OR at Mount Sinai interested in cutting down, because they were just shocked how much waste there is in the OR packaging.
I'm actually quite hopeful that Sinai might be receptive, because we've actually just switched from styrofoam to paper cups.
Nice.
Great.
So it's
Right.
one step, it's one thing. I mean, it was going to happen eventually. I'm pretty sure styrofoam's on its way out federally, or it should be, hopefully. So I hope that the feeling at the hospital is this is something that's important to them, as it's important to, it sounds like, other people at other hospitals. So anywhere that we can find someone who's willing to be on kind of our team, I think we should kind of grab them when the moment is right.
Yeah, no kidding. That's incredible.
Hilda, do you want to touch on the Kane ONEIG memorandum of understanding and where that's standing?
Well, we're just going to start talking about it. I mean, Rob, Kane has had a couple of meetings, and they really would like to have a much closer relationship with ONEIG. They actually talked about merging, but the financial position at this point, it was just not going to work out for Kane. The difference between ONEIG and Kane is that CNA gets absolutely no help from Kane gets absolutely no help from CNA, whereas in RNAO, all the office staff are very receptive to helping us. Now that may change. Jacqueline has put her name down to go on the board of CNA. So then she will be pushing for more involvement. But it's very, very tough for Kane to do it financially, because everything we take for granted, Carrie sending out emails to staff, Carrie helping to plan our programs. That does not exist with Kane. It's volunteers who have to do everything ourselves. So when they looked at the amount of money that was coming in for membership, they didn't think it would be viable for Kane to be able to exist if they had to take such a decrease in membership fees. And that was the only stumbling block. They were very, very receptive to joining, like a lot of other national into other groups have done, but going down in membership fees, they just couldn't see that they would survive. So the next best thing is a memorandum of understanding. And actually, having worked with another synagogue group with a different philosophy, I think that we are better off doing it thoughtfully and carefully than rushing into it and then having people upset with each other. It's a very different environment, just in the fact that RNAO ONEIG gets so much help from home office and Kane gets no help. So, you know, they want to sign on, for example, they want to sign on to something, they do, whereas we get permission to through RNAO office before we sign on to something. It is a little bit different. I think Kane is totally autonomous because they've had to be. CNA doesn't help, where ONEIG has wonderful staff in home office who have helped a lot.
That's a really good summary of some of the differences and some of the things that we really need to work on and talk through, right? Because yeah, you're right. Those are some of the really key issues in building this relationship that could set us up for a really long time, right? So we want to do it right.
And another big thing I thought of is the membership list. Like, we get no access to our members. They get access to all their members. So, like, you know, there's a couple of things that could be problematic if you don't think about it and work it out carefully.
Yeah, that's really fair. So yeah, we're in the worst with that. And as things change, like I'm sure it's going to be, we're going to get the word out in all the ways that we usually do, through emails and through online. We're going to, you know, to talk about as this kind of comes together with Kane. So we'll keep you in the loop, everyone. All right. And we're going to talk a little bit about COP2, I think, because that's a really important piece to bring up. Here are some of the events that you might have missed, and some of them are already online and some of them aren't quite yet. But in March, we collaborated with the Community Health Nurses Initiatives group, and I spoke as part of ONEIG, and Randall von Wagner spoke as part of Treat Canada. Pardon me. And then they both we both talked about really like issues in Ontario and kind of the legislative landscape with regards to the environment and land use change. So that video, we're working on some technical issues, but it's in the works. It should get posted soon. We did have a forest walk planned in April, and that was like rained out with a horrible rainstorm. So me and the chair of the Waterloo chapter, who was actually one of the professors, went for a nice walk, but no one else came in the downpour, which I understand. But we did get the resources out to everyone. So just an update on that one. And then most recently, I had like a really fun event, and a bunch of people here spoke to their experiences in an event called Stories in Celebration. And I'll put the YouTube link in the chat in a couple of minutes here, so you can take a look at that event, because it turned out it was a pretty cool event, and we heard lots of stories from different nurses involved with Kane, or have been involved with Kane in different ways, and involved with ONEIG as well. And now the upcoming news. I know, Hilda, you've got some things in the work, and we're kind of like on the side for those, but you might want to talk a little bit about that, because there's some cool events. And we're also planning for our ONEIG AGM. We try to usually make that like a bigger event and bring a speaker in. So we're doing that work. And then a huge thing that we're planning for is possibly attending COP28. And I hope, Rob, you might be able to give just a couple of minutes of context for that and where we're at.
So COP28, for those who don't know, it's the Conference of the Parties. It's where all the people from all over the world come to talk about climate change and how that's where the Paris Agreement was done. It was at COP 15, COP 28, or wait, no, COP 15, COP 21, COP 21 in 2015. It's where a lot of the international treaties and agreements are made, and there's the actual parties, which are the countries who are privy to these agreements, and then there's observers, and we have a provisional observer status for going to Dubai, being not ONEIG but RNAO as a larger organization. But it's been us pushing it forward. So we're hoping to have Ontario nurses represented in Dubai to really push for planetary health and keep that to the forefront. You know, we have smoke right now, and PM 2.5 particles covering most of Eastern Canada right now, and pretty much all of Canada within the last month at one point or another. And that's really bad for respiratory health. And a lot of that's brought on by climate change. So planetary health is going to be one of the biggest things coming up in the next decade. And we have to be there. We have to be at the front of that curve, pushing that. And there will be emissions for us flying to Dubai. We will have a carbon footprint going. But if we're not there creating that network and pushing that agenda, then who is? Currently the CEO of COP28 is the Dubai or the Emirates oil company's CEO, which is so messed up. So if we don't have people there like us pushing for this, it's just going to be, money talking instead of, human health talking and the human cost of climate change talking. So we're trying to get that to go. And we have little kids running into the house right now. So, yeah. So we're trying to get that organized. We're trying to get the financials sorted out for that. I think I have to mute my
Don't worry, don't worry. That may very well happen to me quite soon. I know one of my kids is due soon. This is life, but thanks, Rob. I think that gave really good background. So we're like really talking about logistics right now, because we have that that initial like approval from the organization to go, but we're just waiting for that. That is like to help us plan, and then there'll be a final approval that'll come later on. Okay, so let's go to the next slide, Rob. This is just me showing off. So go to our YouTube channel. It's just ONEIG RNAO, and check out the Earth Day video. You'll see what some people said. It's really interesting and to hear from nurses and some of the nurses here in our executive too, what they think, what they have to say about this topic, investing in our planet, and questions around that. So go check it out. It was pulled together by Emma, who features in the video as well. And I just think it's there's this video. We also put like the video of this meeting and all the other meetings and other events when we host them. So take a look there and subscribe. That's my plug there. All right, next slide, please, Rob. And this one is for Victoria.
Okay, so it's really quick, our finance report. As of March 22nd, our last meeting, our balance was $9,913.60. We did have our RNAO recipient, the winner of our scholarship. So we did disperse that, and the fee was $100. The Queen's Park, Jocelyn was able to go to that. So we did reimburse her for the hotel stay there. We had a Facebook ad up, which I don't have the specifics of, but it reached, I think, I want to say 145 people. I could be wrong. Don't quote me on that though. But it did reach a lot of people. And then our TD fees, which I know it says times 10. That is for so far the year, there has only been 3 e-transfers at $1.50 each. So that's the 450. So we're currently at $8,591.42. It is quite a lot of money to have in our bank. But we have many projects on the go. and a lot of great ideas coming in. So I know we wanted to get banners and signs so that when we are in like a political presence, we have something to represent ourselves other than just us. And I think we were aiming to get 3 of them, if I'm not mistaken, for different areas of Ontario. And then we've got speakers and honorariums, which that amount, $300, is subject to change only because our AGM, we're gonna recruit somebody to speak, at least 1 or 2 people. I think one time we had like 3 people. It was great. So that is subject to change there. Social media ads, I've still allotted $40 for that, and a member engagement is $60. I haven't mentioned anything to anybody, but I am trying to work on a monarch butterfly presentation, where we can give away like, something that you can grow your own. I don't know if that's the right words for this. Sorry, this pregnancy brain kicking in at the worst times. You essentially grow your own monarch butterflies and release them. It's really, really cool. So that's one project I was looking at. And then our RNAO AGM presence. So being at the RNAO AGM. So that's where that all stands. Is there any questions or anything about the finance report?
Just a note too that we have then another $2,200 set aside for the scholarship right now, right?
Yes, because this is
Yeah.
only year 1 of 3. It is a 3-year commitment. It's not a priority right now, but I know we had mentioned something about possibly creating another, like a secondary scholarship because of our funds. Again, it's not in the books yet, but it is an idea that we are working with. Yeah, Emma.
If I remember correctly, wasn't there some question of creating a scholarship or a fund that was going to be directed at graduate students? Because I thought there was some question about whether the RNFOO grant was only available for undergraduate
It
level.
is, so that was part of it.
Okay.
We got some feedback from them in regards to how many people applied to our scholarship, how many were actual members of ONEIG, and so forth. So we can use that to make a decision later on. But it's not, there's no like dire pressure to come up with this yet.
So a part of that talk related to that was there's not a lot of environmental health at the undergrad level, whereas people start pursuing it at the graduate level. So there would be scholarship going towards that. Also, regarding COP28, we're hoping RNAO head office is going to cover the bill for whatever that will cost. But if there is only a partial covering of the bill, there might be funds going for that. Also, if we do get ourselves organized and manage to launch this greening the supply chain and greening healthcare campaign, that also will cost some money to foot that campaign. So
Next year is our big
spend year.
pretty much, yeah. In a nutshell, it's our big
We've
money
saved up and now we have something to now we have things to spend it on.
yeah.
And if people are interested in going to COP28, there will be limited number of seats, but if you are interested, please. We had a spreadsheet that went out amongst the executive, but if anybody beyond the executive is interested, please email us and contact us about it, because everyone has work and other commitments and people want to go but maybe can't go, and having somebody as a backup, or it would be great to know where other people stand. So if you're interested, please tell us.
Perfect. Thanks, Victoria. Thanks, Rob. I think our next slide, and I don't think he's made it here, but can you move? Yeah, you can do this hard, Victoria.
Oh, you want me to do it? Okay. So we did do the $1,000 scholarships with the RNFOO. And it was Toby Bowers. He is currently, I believe he's at a clinical practicum. And he's gonna get home later today. So he said he might be able to pop in. He might come later on. He might not be able to. He does have a son too. But a little bit about him. He worked in a nonprofit organization, which showed him the importance of social justice and the determinants of health. It attracted him to nursing for a second career. So he is currently working as an RPN at the Toronto General Hospital in the multi-organ transplant unit and studies for his BSCN at Nipissing. So when he's not at work, he likes to go to local parks with his family and friends. He is also, as part of the agreement for the scholarship, was to write an article in our newsletter. So I've been in contact with him about that. So you can look forward to that in one of our upcoming newsletters. I think the next one we have is in July, I believe.
I did a Google search on him, and I think he is the nonprofit was a bike advocacy group doing like active transportation, something chain something.
Nice, okay.
So in Toronto.
I didn't pry too much.
Amazing. Well, congratulations, Toby, if you end up watching this afterwards. Congratulations.
Yeah.
We're also excited that you're our first scholarship winner. Yeah, we're going to get in touch. That newsletter, I contacted Jess, who sent her regrets for tonight, but she is going to be putting that together likely in July. So you can get newsletter articles to her now, and that's executive and everybody else who's here. If you have
General
something,
members.
yeah, if you're a member, you have something like related to the environment and health, and pull together an idea, pitch it, and we'll see if we can get it in there. Even pictures are really great to have too. So yeah, that's awesome. Congratulations, Toby. All right, and let's see what's next. Okay. Oh, yes, here's the next part. So this is a bit of a long part of our session today, but there's some really interesting stuff in here. So this is where we kind of cross beyond environmental health, because this is all of the resolutions that are coming to the RNAO AGM. We have a kid that just came in, do the best I can. These resolutions come from all different sectors, and we're just going to kind of go through them. Rob is going to be voting as our representative at the RNAO AGM, as ONEIG's representative. So we're just kind of giving like some feedback, and I didn't include all the background information because we don't really have time for that, but take a minute and I'll read it. And then if you want to give thoughts, great. And if not, that's okay too. And you can always send thoughts through our email.
There is also opportunity at the AGM to modify the wording on it. So regarding these resolutions, we can either be in favor, be not in favor of them, but we could also say, oh, I would like this change to this or this change to this within, and the person submitting it may or may not accept those changes, but it can go like that. So if you have something that you want, like a wording changed, and we as a group think that's a good idea, there we go. So
yeah,
I'm
perfect.
gonna
And these
take
meetings
notes.
are usually very helpful, and that's what happens. Things are a little clearer once we discuss it. And so when they come to actually present the resolution, it's a little bit clearer what is wanted. Sometimes they don't really have it exactly the way they are trying to get across.
Yeah, and I mean, and because a lot of us are going to be seeing these for the first time, you may need some time to think about it, and that's fine. We can always get feedback later on, or even at the end, if you're like, actually, I have a thought about number 3. If we have time, we can go back. Okay, so resolution 1, expand nurse practitioner regulatory authority under the Vital Statistics Act for medical certificate of death completion in all circumstances. So they state, whereas there is strong evidence that nurse practitioners improve access, health outcomes, and patient satisfaction across care settings. Whereas there is strong evidence that NPs improve access to quality end-of-life care to support patients and their loved ones. Whereas existing legislation and regulatory barriers prevent NPs from functioning within their full scope of practice. Therefore, be it resolved, the RNAO, in collaboration with the NPIG, the Nurse Practitioners Interest Group, advocates for expanding NP regulatory authority under the Vital Statistics Act to support MCOD completion.
So what can they not do right now regarding this?
Yeah, they just can't sign the certificate of death, I think. They can't complete that themselves.
Because they can be a
Um,
coroner.
I think that it's like, yeah, I think they have the professional capacity to do it, like the knowledge, skill, and judgment, and that's the argument here, but they aren't able to do it under this legislative framework as of yet, as of right now. So they can't actually, like, they still require a physician to oversee that in some way. Yeah, and I don't know, that's another thing to ask, is like to ask for the fine details. The
Kathleen,
background will give us more.
you do Kathleen, you do volunteer work with head office. I'm gonna put you on the spot. Do you know anything more about this?
Sorry, no, I was just okay, so this is probably maybe I'm guessing this was put forward by the NP group. This wasn't forward by your group, right? Okay.
No.
No.
The first three resolutions are up for the NP group.
Oh, okay. So there must be, like Jocelyn, I think, hinted to, there must be situations.
Okay.
I think if it's like not an expected death, so there must be stipulations within where, like, if it's an expected death or maybe like a critical event or something like that, then maybe they're not allowed to.
Okay. Are they allowed to do certificates of death in other circumstances?
I think so. I think so.
That-
Because like I work in the hospital sector too, and like I know sometimes they'll act as MRPs, and same within long-term care. So I think it's only like well, existing, there must be, like I said, there must be existing legislative and regulatory barriers in the act somewhere, in this Vital Statistics Act, that they're looking to have changed.
So basically, we have to figure out what that barrier is, and then I don't see any reason to oppose this. Does anybody have any reason to oppose this?
No, and that might be in the background. We just don't have space and time for tonight to go through that. So
Yeah.
you may be able to find it there. I agree. I don't see a reason to oppose it either.
Did you guys receive, so I have not received, I have not received any of the resolutions.
I had to email head office to get it sent to us because it was
Okay.
I got stuck in this loop on the RNAO website where I couldn't actually access it.
Yeah, and in this previous slide, I said the same thing, that it hasn't been sent widely to members. Only consultative
Okay.
reps have gotten it.
Only consultation reps.
Yeah.
Yes, because that is their role, and they would have received also the
Robert's Rule of Orders
and all the background information. So somewhere probably in this 1 to 2 page backgrounder is more details than to support the resolution.
So I'm gonna have to read through that and figure that one out then.
Yeah. So
And members who attend the AGM do get those documents.
Yeah.
They just haven't gotten it yet this year.
it's probably not been released on the website yet. Yeah, I know. All
But
of a
it
sudden
used
it's
to
been
be.
June,
It
and I
used
don't
to
know
be
where.
open to everybody.
Yeah, it
It
is
used to
usually
be.
open
It's the
to
first year
members.
it's not open to everybody.
I think it might just be a delay, Hilda. That's my impression. It's just not up yet. It looks like there's a place for it. When I tried it, like you said, Rob, I did the circular kind of thing. It looks like there's a
Yeah.
place for it, but it's just not there yet. So
Oh,
that's
there's
why
a
we always
place
do this
for
every
it.
year at this time of year. So it, yeah, it just isn't this year. But yeah.
So back to resolution 1. Is there any issues with resolution 1? Or shall we move on to resolution 2? There's 12 of them to go through, so we have to go through them reasonably fast.
I
Anything
think
with
we're okay on
resolution
this
1?
one.
Next one.
Yeah, put it in the chat if you think of something later, okay? Resolution 2, support the inclusion of nurse practitioner authorization on the Ministry of Health's application for funding hearing devices form. Whereas there's strong evidence for nurse practitioners improve access, health outcomes, and patient satisfaction across care settings, and there's strong evidence that NPs can meet the complex care needs of older adults across healthcare settings as the most responsible care provider, whereas healthcare needs of rapidly aging population and strain on the healthcare system have heightened the need to support the health and well-being of older adults as vulnerable populations across healthcare settings or care settings. Therefore, be it resolved that the RNAO, in collaboration with the NPIG, advocate for ministry support for the inclusion of NPs to complete authorization on the application for funding hearing devices form. So like a referral form to allow for funding. It's similar scope. Any thoughts on that?
I think it's ridiculous how many forms we have to fill out just for funding.
Yeah.
I would like to put a resolution forward to reduce the amount of paperwork that we have to do as healthcare workers.
Yeah, maybe that's next.
More clinical work.
Next thing
Any opposition to this resolution?
in principle. Okay. All right, let's move on to number 3. All right, and this one. So it's similar expansion of scope. Resolution 3, expand Ministry of Health and Long-Term Care's funding to support the inclusion of attending nurse practitioners in retirement homes and assisted living facilities. Whereas there's strong evidence of the efficacy of nurse practitioners, there's strong evidence that they can meet the complex care needs of older adults in retirement homes and assisted living facilities. And whereas the healthcare needs of rapidly aging population and the strain of healthcare system has heightened the need for support for older populations, be it resolved that the RNAO, in collaboration with the MPIG, advocate for ministry funding to support the inclusion of attending nurse practitioners in retirement homes and assisted living facilities.
I think there already are nurse practitioners in the nursing homes.
They are
So
there,
what
but maybe
does-
they're not in that role.
What
Sorry,
does
go ahead.
like is that like their whole role is to be for that home, like a
Be the attending, like
So, so I work in the community sector too. So, they're already in long-term care, and I think they promised, I can't remember if it was 70 or maybe like somewhere nurse practitioners. This is in like retirement homes and like private care facilities.
okay.
So I think that this is going to be a little bit more of a difficult thing. And I don't know if this is I don't know. I wasn't part of the resolution committee or consultation. There will be other sessions that we can sit on too, leading up to the AGM. But yeah, I think that that's what they're asking for, is for more funding for them to, and I do know that I believe the government is looking at different models of care. And so maybe anchoring more primary care. And like, let's say, there's a retirement home and then there's seniors kind of around, and anchoring them there to help facilitate like ED diversion and access to primary care. So there could be a potential for quote unquote innovation within our
Okay, so this is more like Chartwell's retirement home or Rivera, and get a nurse practitioner on board there, where currently it's just an RPN doing everything. Okay. This could be very expensive though. Like,
yeah, there's definitely a lot more retirement homes than there are long-term care homes.
just to be like just to, I don't know, put a critical lens on it, like this could be a very expensive thing to do. Is it going to have the same bang for its buck? I don't know. Is it?
I know
Emma?
what
Emma
RNAO has been really pushing forward to is to advance nurse practitioner-led clinics, and calling for more of those. Because we still know that a lot of people don't have family physicians or access to primary care. And then they're seeking it usually in the emergency department or other urgent care centers.
But if we went more to like a NP clinic model versus, I don't know.
You got a comment from Emma.
So I had an instructor who was part of a family NP model practice where you have kind of everybody all together. And I guess unfortunately what happened, according to her, as someone who's involved in that system, is that the government funded all of these family-led practices, these mixed model places, discovered that it's actually more expensive to have NPs, even though the level of care that's being provided is different, and I would say maybe better. So the issue then with comparing like how much is it going to cost, we have to understand who is funding having physicians at these retirement homes. Are they being funded at all? Where is the money currently coming from, if it's coming from anywhere, before we can even ask, is it going to cost more money? I feel like it's beyond the scope of what the resolution is in some ways.
Because I think this is where you need that health economist to see where this is, the pluses or minuses of this. Because like in doctors, they bill it based on the care they give, based on their OHIP, whatever funding.
But what I'm saying
Whereas,
right now, we don't know how much that's costing. So you're right,
yeah,
we need someone who can crunch the numbers, but in the context of what's happening right now, we don't have that information. But would we support this resolution if money was no issue? Or even if it did cost more, would we still be in support?
I
And
don't
what's
know.
that?
Is it beneficial?
And what about time periods? Like it may be like more expensive in the short term, but what are the longer term outcomes? Maybe that's something to look to. Like maybe that's a direction to take a look if you're interested in that in the background. Like specifically look to see how they address the benefits of having an MP versus physician, and if it is really more of a billing barrier, being in the way, and it's not really about the quality of care. Something to look
Yeah.
at.
It's more of the financial question of how it works, not a quality of care.
Yeah, exactly. Like, and if it's something that like, I think in principle, this is again just an expansion of like the possibilities for MPs, like roles that they could take on. Like, do we think they have the again, like the knowledge, skill, and judgment, and are they appropriate for this role? And I think they're taking on very similar roles in other, even more high acuity settings, right? So, from my point of view, it makes sense that I would feel very, they'd be very capable in this role given what MPs do in other settings.
I don't think it's a question of skill and judgment and ability to fill the role. It's like are they going to be well utilized in that role or not well utilized in that role? And I don't understand it well enough to.
Well,
I
it's
don't
like, should they
understand.
be allowed to? Like, should they be allowed to, right? Like, I mean, I guess the other decision levels will like kind of,
It's not
you know what I
allowed
mean?
to though. It's ministry funding. The question isn't allowed to, not allowed to. It's advocate for ministry
Oh,
funding to
yeah, you're
support
right.
the
You're right.
inclusion
Sorry.
of attending NPs.
I see what you're saying. Yeah. So we need to understand more about that, what's needed.
Because yes, we want
I
ED
see what you mean.
diversion for sure. Like, of course, like emergency department is far more expensive than having access to a family doctor, nurse practitioner. But I just don't understand.
Yeah. That was my mistake. Yeah, I hear you. I hear you. Hopefully the background really goes into that detail of the funding structure right now and what's missing and needs to happen. And yeah, and more of the why.
So for which way I should vote on this, as it stands here, without knowing more, should I be endorsing it? Should I be opposing it? Or should I just be asking more questions to figure it out? And based on those questions, which way do you think I should go? Because it's definitely within an MP's scope, but I think it's more within an economy scope of how can we best deal with the money.
Well, the question to ask the submitter, if you don't see it in the background, we don't have the background, is this value for money because this is what the government wants? Like,
Yeah.
if these are stable people, is it the best value to have a nurse practitioner take care of them rather than maybe have a nurse-led nurse practitioner clinic in the community?
I think it'd be really cool to see nurse practitioners who can go and do who have the time and funding to go do home visits. That'd be amazing. Because getting somebody who's, not necessarily mobility issues, bedbound, getting them to the clinic can be very challenging.
And
And
I've been working with groups that want to age at home. They don't want to go into retirement homes. They don't want to have assisted living. They want to stay in their own homes. And I think it's more value for money to have nurse practitioners help them to be able to stay. And what they're doing, like both University Health Network and Women's College has started a couple of groups, research groups, to try and keep people in their home and have maybe a nurse practitioner spend a few hours in an apartment building
yeah,
to help people stay in their home rather than add to retirement homes and assisted living, which is still not what people want to do. That's not where they want to go. They want to age in their home in their own community.
Yeah. Okay, I think I have this. We have to figure out more information before we decide whether we approve or not approve. Let's go to resolution 4.
Okay, call to action to right-size children's healthcare systems in Ontario. Whereas the Canadian pediatric healthcare system has historically been undersized and continues to be so, lacking the capacity to adequately meet the growing demands of the pediatric population while delivering safe and timely care. Whereas the availability of pediatric healthcare systems and resources are limited, requiring systems to consistently function at capacity without the ability to compensate during a surge or resolve growing backlogs. Whereas a specialized and skilled workforce is essential to deliver healthcare to children, with the present health human resource crisis further exacerbated in pediatrics, encompassing both the loss of skilled workers and the inability to recruit a specialty skilled workforce. Therefore, be it resolved that the Registered Nurses Association of Ontario actively lobby the government to designate funding to scale up infrastructure and a specialized pediatric workforce in order to right-size the pediatric healthcare system to meet the ongoing and growing needs of children in Ontario and more broadly across Canada.
I think
Any
we should
thoughts?
approve this. However, I think we're just bleeding nurses everywhere. Any critical thoughts on this?
Every report I read says that they're struggling, you know, to use the space they have because of their lack of staff. So, and I think, like you said, I hear that in many sectors, but I have heard this from sick kids and in children's specialized hospitals as well.
Same at CHIO.
Yeah. So
But
yeah, I'm on board.
I'm on board, but I think we just need more nurses, period. Pay the nurses well enough to stay in Ontario, stay in nursing in Ontario.
All right, resolution 5, improving the working conditions of nurses and to build necessary capacity to prevent workplace injuries and provide mental health support to healthcare workforce. Whereas nurses are experiencing high workloads as well as mentally and emotionally taxing working conditions, the COVID-19 pandemic has further exacerbated these challenges, and working conditions continuing to deteriorate. Excessive workloads increase nurses' risk of stress, job dissatisfaction, poor physical health, such as work injuries, and poor mental health and well-being. In addition, the healthcare sector is experiencing severe staff shortages as current staff are leaving due to worker burnout, injuries, and disabilities. Whereas poor working conditions for nurses in combination with a rapidly aging workforce set to retire in the coming years, the resulting staff shortages are alarming. Consequently, staff shortages put patient care at risk, affecting the quality of patient-centered care and compromising overall worker safety. Therefore, be it resolved that the RNAO advocated all levels of government for funding for the health sector to improve the working conditions of nurses and create a 5-year strategy to require the health sector organizations to build necessary capacity to prevent workplace injuries and provide mental health supports to the healthcare workforce. Thoughts?
I approve of this, I think. Is there any ways we can make it better?
I do believe it's very similar to another resolution that was brought forward, I think, throughout the pandemic too, focusing on like workplace health and mental health supports, but I can't remember all of them. So I think it is very similar to some of the other resolutions that have come forward.
Well, I know that I'm having to do my LEAP course right now, and they're paying for my LEAP course, and they're paying for the hours that I'm doing the Zoom portion of my LEAP course, but they're not paying for the Zoom. They're not paying for the online modules component, which is going to be like 2 days worth of work. Similarly, like in for doctors, they don't get paid to do a lot of their courses. They pay themselves, but they're contractors. Nurses, we make, I don't know, a fifth of what a doctor makes, third to a fifth. And we're staff, we're employees. Like, I think there's some cultural issues within nursing that I don't think we get paid for all the mandatory courses that we were supposed to keep up on. And I don't know, management just doesn't respect us, period. And some places. I don't know. I think there's a lot of problems that need to be fixed here. But
I
I guess
like
we
it.
can't do that with one resolution either.
It draws attention to like kind of the workplace issues and goes beyond just recruiting, which I do appreciate that it's drawing a light to this. Some things I wonder about though are specifics like why a 5-year strategy in particular. Are we asking all levels of government to create a 5-year strategy, or are we asking RNAO to kind of be part of that building a 5-year strategy? Like some clarification of what's asked. And I think that's what Dominique actually said. Like we might need some more specifics about what's being asked.
Isn't this asking for RNAO to propose
They want to
a
advocate for
strategy?
that's just a little unclear. Advocate all levels of government for funding for the healthcare sector to improve working conditions of nurses. So it's, are they advocating to create a 5-year strategy, or it's advocate as well as create a 5-year strategy? I'm not totally sure. So I need to clarify. I would need to clarify on that. And why, again, why is 5 years the magic number? And yeah, just like understand a little bit more about why the strategy, like how the strategy will help, I guess, too. Like honestly, I'm not entirely sure about like what they're hoping to come out of this, I guess, to put an action plan, maybe create a group, like a subcommittee, like these types of things, like about what this will have. Like it's clear they're addressing a problem here, but how do they want to address it? I'm not totally clear on.
Okay, so I'm just gonna repeat back, clarifying whose strategy it should be, why 5 years, and what results are expected from the 5-year strategy. Did I miss something?
Also, I was thinking maybe you could ask the submitter if there was one concrete thing they want out of it. Like, this is quite abstract and like, we are all the time asking for mental health support, but is there something specific that will be an objective that they can say, yes, we have accomplished this? Like,
An objective result.
yeah, some objective result that they are asking for, because I mean, always we are asking for mental health support. And I think RNAO really advocates all the time, like mental health is a big thing, and we see lots of ways they are advocating. But is there something specific that would meet the objective that would say, yes, we have accomplished something in the way of mental health support?
Yeah. And to make sure it's moving past like just another program to deal with stress, or just another kind of like, burnout prevention system, but like they're talking about, again, like high workloads, like how systems in the system can that be shifted? Like I just think like there needs to be like a focus in on system change, and maybe that can be more emphasized. Okay. Sorry, kids. Any other quick thoughts before we continue on?
What specific system change do we actually want to see?
Yes, and why 5 years? Like,
Yeah.
why did they pick 5 years? Like, why not 2 years or 3 years? Or at the end of 1 year, we have something concrete.
Yeah,
a
and what would this
concrete
look like? Like
objective.
who would be doing part of this strategy? Like just like some details, because RNAO would like that direction, or the more specific we get, the more likely that outcome, that
Do you
direction
think
will be
though
taken.
most organizations like create like a 5-year strategic plan, like, and it's reviewed, like, and then it's like, and I think so that's probably where the 5-year mark comes from.
Yeah, maybe that's something aligned with what RNAO typically does.
RNAO doesn't really do that, but other organizations
Yeah.
or healthcare sectors do that.
5-year
I see,
plan,
so it
but then
aligns with there.
it's just one of those things that kind of goes out there but doesn't always get met.
Yeah, and like what infrastructure would you need for this 5-year plan? Like who's evaluating it? Like, like I'm just like thinking through what it means to do that. Is that a government-led strategy again? Like I guess that's another piece, like, or RNAO-led. Because they
Who's
often talk about
evaluating?
resources, like human resources in RNAO and how limited they are. And so would this mean moving a staff member into this role, or
Well,
maybe
we
that's
can't even
already
get emails
redundant?
sent out on time right now.
maybe it's already like redundant because they're already doing so much work with the like the new reports that they have and the new like nursing to change, you know, the new like nursing workforce reports and that work they've been doing. I think this fits in with that too, right? So another thing, like maybe this is redundant, maybe they're already working on it. This
Well,
area.
in its vagueness, it's redundant. If it's specific, it may not be redundant.
Yes, that's true. All
All right,
right.
moving
We have
on.
6 more. Yep. Okay. Resolution 6, integrated strategy to address opioid crisis. Whereas opioid use and substance use disorder is resulting in unacceptably high rates of hospitalization, death, individual and family suffering, healthcare worker and system burden, costing Canadians billions of dollars per year. Whereas in spite of calls to action and ongoing initiatives provided by the RNAO, healthcare workers continue to demonstrate knowledge gaps about opioid use, harm reduction, treatment, and trauma-informed approaches to care, resulting in inaccessible and inappropriate care, continued stigma toward persons with use disorders, I think that is, and moral distress for those caring for them. Whereas continued lack of resources continue to delay and minimize comprehensive harm reduction approaches necessary to prevent opioid deaths and leave RNs and other healthcare workers with no accessible experts to support them or those with substance use disorder in the community. Therefore, be it resolved that RNAO and its membership continues to call for the Ministry of Health and its allied partners to create and fund the role of regional trauma-informed SED coordinators to support and educate those working with this population and those they serve. Thoughts?
I think it's a great resolution. A sidebar to this is that our opioid crisis is going down. The numbers, I don't have the numbers on me specifically, but they have gone down quite a bit in the last, I think in the last 3 years,
Eight.
surprisingly, with COVID and everything. But I do like this resolution to call for the support to care for those people.
And Emma is saying it's very clear what the ask is for. Coordinator role. Are we creating a So obviously this whoever is sending this forward is probably saying identified a need, and that's probably why they want it. Because it seems
Yeah,
like
this was Kathy Moreland. So she was really pushing the whole opioid focus at the Queen's Park, and has a lot of experience and knowledge on this subject. Yeah,
again, is this good role? Is this good value for money for this coordinator role?
one thing I like is that it's regional because
Yeah.
inequity in service delivery is a really big problem.
Yes.
So in some areas it may be going better and they have the access to harm reduction services, and other areas have very little to none. And so if that could bring some supports to areas that don't currently have them right now, and some advocacy as well, if somebody is in a coordinator role.
It'd be really cool.
The
Yes.
thing about this resolution is I don't think it goes far enough, and I think RNAO has already taken it upon itself. Like I'm going to be going to a harm reduction webinar in another couple of weeks. And it's not just the people working with the population. I think everybody should know, because then we can also prevent it. Maybe we see somebody and we may see that they are starting to think about opioids. So you want to make sure that you increase the awareness to people so that they see danger signs and not necessarily just traumatized people. Anyone can be in a position where they're traumatized and take on opioids. So I think that RNAO already has a very broad scope and is already starting to educate people. And I think we want people to be educated more than just people working with these people.
Hilda, if I can just interject, I think Kathleen has brought
Yeah.
up the point that this role isn't necessarily a direct patient-facing role. It's somebody who would provide education and support and resources to people that are client-facing.
Probably continuity too, because there's probably, like one little thing here and then something else there. Even within a region, like within Ottawa, we have a few different things, but it would potentially create continuity amongst all of them. And I see issues with this maybe up north where they're very under-resourced and maybe there'd be benefit, especially having a regional one. I think there should be a strong focus for making sure rural and northern Ontario don't fall through the cracks on this. Is there any comments on that aspect?
Just that they already are, and it's like there's no services where my family is. There's like you'd have to drive 5 hours to go to Thunder Bay. It's already even like underserviced, I think, in my like Kitchener, Cambridge, Waterloo area. Like there's like one service base, but people can't even get to there. So like we really do need people advocating for the system. And I feel somebody in this coordinating, educating role would have a natural fit and maybe could network, like you said, like network across the province to kind of have more equity and access to services. I just see potential, but I'm not sure of all the details here.
Yeah, the regional aspect really sticks out to me. I think we should approve this. Anyone opposing? Yeah.
Okay, maybe we can move on. And yeah, Kathleen, building capacity. And that's kind of the big focus, right? There's still stigma and people are still, I just put this in here as we're about halfway through, guys.
Where's you're in a Grumman somewhere. Where are you guys in the Grumman?
I don't even remember where this one was taken. That's my little one though. But yeah, canoeing somewhere in the Grand network, the Grand River network.
Nice.
Yeah. And then just a little B, just because we're halfway through the resolutions, everyone. All right, let's move on to the next one. Let's see what's here.
Love the Grumman.
I'm gonna take a stretch. Okay. Resolution 7. So we go up to 11, everyone. Increasing new nurse retention and capacity by decreasing barriers that exist for accommodated northern and new registered nurses. Whereas as a profession, we're losing numbers because of the registration process, stress, system issues, and recognition. The time between graduating university and registration with the CNO is a time where new registered applicants are not students and are not members of the college. They're in a transitional, unsupported environment. Whereas accommodated new registered nursing applicants can write locally in Northern Ontario and must go out of province, fly to Southern Ontario, or go to the US to write the NCLEX exam. They cannot access testing dates, times, and services equal to others. I think I got moved. Can you go back to that previous slide, Rob? Okay, all nursing applicants could benefit from a review of the current registration and examination process. Therefore, be it resolved, because RNAO is an association for both nurses and nursing students, it's uniquely positioned to lead and support new registered applicants by reviewing the registration process, advocating for change, and creating a forum where support and direction can be given to new registered applicants. Therefore, be it further resolved that the RNAO will champion the issue of building capacity and resilience in accommodated northern and new nursing registrants by reviewing current system issues and that act as a barrier to seamless, accessible, equitable testing and registration. So they want the RNAO to be a mediator here and to provide some oversight and review of the current registrants process for students.
I approve. Any opposition or critical thought on it?
I approve. I think it should be looked at.
Huge gaps up north. Definitely approve. Good. Okay, moving on.
All right. Resolution 8, greater representation of Black nurse practitioners in healthcare settings. Whereas the pandemic highlighted a disproportionate number of Black people's health was negatively affected due to the systematic inequalities, such as historical oppression, structural racism, segregation, and environmental racism, including mistrust due to the lack of representation of Black professionals in the healthcare system. Where studies show that Black patients, clients, families have better results when they're treated by Black healthcare workers, and in this case, nurse practitioners. And there's a direct correlation between health and the access to and trust in healthcare workers. Therefore, representation in healthcare leads to better health outcomes. Whereas Black NPs are positioned as nurse leaders in healthcare that embrace sustainable development goals aimed at advancing inclusive, equitable health and social systems that leave no one behind. Therefore, be it resolved that the RNAO support the mentoring, recruitment, and retention of Black NPs to address persistent inequities and obstacles in accessing culturally safe, inclusive, and sensitive care in Ontario. Be it further resolved that the RNAO advocates to set targets of Black NPs admitted yearly and provide funding to Black NPs to attract, mentor, network, and retain them to achieve such targets with the MOH, Council of Ontario University programs in nursing. All right, thoughts? All right, first thoughts are yes. Looks good, unless that was in the previous one. Any thoughts or any reasons why we want to question this, or want to be any need for clarity?
Why
the
just the
only,
one
the
group?
only thing talking about equity, if you put targets on Black, what about Asian and Indigenous, and like there's so many underrepresentative groups, Chinese, like how, like I just, the thought of having
What about
quota for one,
changing? What about just changing to BIPOC instead of just Black?
Well, maybe like I think that's where we look at the background to see if this is specifically a cultural group that is like even more so underrepresented. And then sometimes we also need to think about, like when we talk about like Black Lives Matter, for example, that sometimes it's important to focus in on one group to address an issue with one group. Doesn't mean that we're ignoring all the other groups, but that we're addressing a problem that exists. So I just want to put that out there too.
Yeah, but I could see the same thing happening with Indigenous groups as well, like, or if not more so.
And maybe that's a question, like does the RNAO have capacity to launch programs to ensure that multiple underserved groups, or underrepresented, sorry, I should say, underrepresented groups, are supported?
it's just to set targets, like I just don't like that, because we're doing exactly what we don't want to do. Like you don't want to set one group out, and like you want people, I mean everybody's qualified, but you don't want to say, oh, I have to put in a token Black or a token Chinese or Asian. You want it to be something to do with merit, and oh, I've reached 10, I've got to reach 11, so therefore you ignore everybody else applying because you have to reach target number 11. Like I just don't like that. I don't think it's a fairness to it.
I
And
think I've
just to,
heard, yeah, and I hear you, and I think this is kind of like a story that we hear often when in this kind of work that's trying to like increase representation, is like, how do we increase representation without supporting the group that is underrepresented? And Emma, I think you have a good point in the chat here about how difficult it could be for somebody who's not part of a group to see to like see this issue the same way as somebody who's part of the group. And that I think it's sometimes important for us to consider that maybe we may not have the perspective that's needed to address this issue here. Yeah,
The
thanks
other
for
thing
bringing that up.
is, it changes like from one generation to another. In one generation, it's wanting it to be considered this way. Another generation wants it to be considered a different way. If you look back at the 1982 Constitution, we're using one wording for, we're calling it Aboriginal. Another 20 years later, it's changed to First Nations, Indigenous, and it's not. I don't know. It's something that it's cautious. I don't want to like not support it, but at the same time, like Emma, how can you explain how we could abstain from this and why that might be a valid argument?
I just feel that at this stage, we don't know enough about the situation, and that as somebody who is not part of that group, it would be really difficult for me to come in and say, well, this is my opinion, or I think you should or shouldn't, when I don't really know what the experience is. I would say that some people would say that, yes, you don't want to set a limit and you want things to be based on merit, but there's also an argument to be made that historically people who were more than qualified were not in a position to get these places because they maybe didn't have the references that they needed because of historically where they have been placed in society. So you could have two people who are both of merit, but one person doesn't have the references because of where they're located, geographically, socially, economically. And so I can see why it would be important to support something like this, to say it needs to be, sometimes you have to put things in place in order to make it equitable. because society has not yet progressed. And I
So
think it sounds like that's what they're asking for, but I also agree with what Hilda's saying, is that we do need to be careful that it's not just a quota, it's not just a token. Oh, here's
Yes,
a
yes,
person
that's
done.
what I mean.
So
That somebody gets it as a token and they sit in the office and never are included in anything, but the token is, yes, we've got our one person or two people.
but I also think that a lot of people are aware of both of those perspectives on these types of issues. And so this might be a time where we say, take a step back, let the people who are knowledgeable about these issues, who can come with us with data and the numbers to back it up, let them speak to it, and then make a decision based on that, but not to
But
be a voice, just to be a listener.
okay, but so here though, you're either approving, you're either voting yes, voting no, or abstaining. And if we vote yes, it's great. We look like an ally, and that's there. If we vote no, there might be reasons for voting no. If we vote abstain, well, that's also not being an ally. And I don't know. I don't like, yes, you have to listen, but at the end of the day, you still have to make a decision about how you vote.
That's not exactly true, because there also is the discussion with the submitters. If we ask them to change wording sometimes, like,
Yeah, and I think part of it, like a lot of might come out, like discussion might happen during that talk. And also think about like what are, like you said, Rob, like what are the consequences of not approving it? Like, what are the consequences of approving it? Like even with your hesitations, like the RNAO takes these as directions to do work in that, not always exactly prescribed in the way that a resolution has been set out, but as a direction that the membership supports this in intent, to do work to increase representation of Black nurses and Black nurse practitioners in healthcare. So think about that too. Like personally, I would say, I think it has I think I like the direction they would take RNAO in, like that. And it was submitted, I think, by the Black Nurses Leading Change Interest Group. So it's a group that has been working together and negotiating some of these issues.
So would everybody here want that approved by me to vote to approve this at the meeting, or would you prefer that I abstain from it at the meeting? So thumbs up if you want it approved. And okay, so I have see a few people that say they want it approved. Okay, and if somebody wants me, what are my other reactions? Is there a motion I can, okay, is there a gesture you can put to abstain? Jocelyn, which one should people put to abstain? What reaction should that be?
The open mouth face.
Open mouth face. Open
I'm
mouth
not
face
sure.
to abstain.
And some people may not have feedback right now, and that's okay too. Rob, we put the trust in you to make a decision that feels right. That's what we do every time. We give you this feedback, but you
yes,
always make a decision that feels right based on what you've been thinking about and reading about and your discussion in that consultation rep session. So just and did anyone want this to be voted down? Sorry, and we didn't get to that. And I guess that would be I don't know what face.
and Rob, don't forget also, there's a lot of discussion on the floor from other people also.
Yeah.
So people chime in. Just because we have this meeting doesn't mean this is the final thing.
No. And the guy
Members,
from Sudbury always has lots to add.
yes.
Yeah, that's right.
I forget what his name is, but he always has lots to add. Andre or something?
Our friends, our French friend, what's his name again? Paul Andre. Yeah.
Paul Andre.
He is very
Oh
good at
yeah,
asking
Paul
those
Andre is
critical
always,
questions.
He will ask
I'm
lots
sure
of critical
Paul Andre
questions.
will have I'm sure Paul Andre will have something to say about this, because
All
then you're
right.
talking about French and you're talking about gay, and so he will put in his 2 cents worth, and so we may have it a little bit differently than what it's like now.
Yeah,
Yes.
like we'll talk it out. Everyone will talk it out together. All right, let's see what's next. On the list, we got 2 more to go. And then we are running late, but we'll try and just spend a couple minutes on these next 2. So anti-racist education for existing healthcare professionals. Whereas racism has been declared a social determinant of health and a public health crisis, whereas evidence shows that racism in healthcare settings harm Black people, whereas healthcare institutions that fail to commit or incorporate the principles of anti-racism as developed by Black peoples will continue to create and perpetuate harm. Therefore, be it resolved, the RNAO advocates for organizations to incorporate mandatory anti-racism curricula developed by Black peoples into all continuing education and professional development training for existing health professionals within the MOH, College of Nurses of Ontario, and the Ontario Hospital Association. All right, thoughts?
So anti-racism, well, not anti-racism, but like this word anti-racist seems to be a new word in the last few years. It seems to have taken a different it's a stronger word than was used previously, I think. Has anybody else noticed that trend? No? Okay.
It's definitely been coming up in a lot of different circles that being anti-racist is more about an act
Yeah.
rather than just a perspective.
Because 5 years ago, I didn't see it talked about like this, and this has changed.
And there is a lot of talk in different circles to have that racism curriculum. It's in the police now, like, you
Yeah.
know, this is really being very broadly advocated for.
Is there any reason not to support this? Justin ran away for a sec.
I think the only thing is what we brought up with the last one is that, well, we understand that there's perhaps a greater history and more acts of discrimination against Black people in Ontario. We also have to recognize that maybe this should be a more encompassing resolution, especially to incorporate Indigenous or other marginalized like LGBTQ plus communities. I think it's really, well, I guess that wouldn't be anti-racism except for the Indigenous part, but I would, if anything, I would push them to broaden who the anti-racism curriculum.
I agree,
focuses
because,
on.
you know, like the Asians now, with all this talk about China also, like there's some negative impact on some of people. Like, I think it should be broadly. I think anti-racism is exactly that, anti-racism, and it's not just Black people experiencing it. It's all marginalized groups experiencing it.
Yeah, and I'd be surprised to not see collaboration actually, because anti-racism has a lot to do with like structures, you know, like structures in our society, like and colonial structures, and like actively working against those systemic racisms that the Indigenous nurses aren't here embedded in this as well, like as another big group in our RNAO, and of course many others. So yeah,
Right.
that's my thought on this too. I've been listening, I just couldn't actually be here for a second. Maybe you can take that feedback back with you, Rob, and just see what they talk about.
Yes, I had a little guy here for a moment. So summarizing, broadening this curriculum, add Indigenous perspective.
Yeah, just as one, but because we also have an interest group, like that is Indigenous nurses. I would be interested to hear what they think, and like whether this could be a collaborative piece. Yeah, that brings together the many layers of and experiences of racism in ours.
I think anti-racism curriculum is exactly that. It covers. It is racism wherever it exists, and it's quite extensive through society.
Yeah. All right. It's good
Hey,
feedback.
sorry,
Gosh.
I had a 4-year-old come and talk to me about
Oh
something.
no, I heard the little voice. I knew
Yeah.
there's somebody around. All right, let's we got resolution 10, then just one more after this, everyone. So a call to action, the healthcare workers, specifically the chief medical officer of health, be an independent decision maker. Whereas currently the chief medical officer of health is a deputy minister, where his declarations must be, or their declarations must be approved by the different ministries and by the premier, so it dissolves autonomy of the CMOH. Whereas decisions regarding the COVID pandemic haven't always been based on medical science by the CMOH, but on direction by the political entities, which may cause conflicts of interest and negative health effects on population health. Whereas in having good public health protocols in a pandemic like COVID comes decreased morbidity like long COVID, decreased mortality, decreased hospitalizations, and economic restraint on the public pocketbook, decreased disruptions to society like work absences, decrease social and health inequities between people, and more. Be it resolved that the Registered Nurses Association of Ontario advocate to the provincial government to make the Chief Medical Officer of Health independent of government.
I think this is hilarious.
And this was really led by Margaretta, who just cannot stand what has happened during the pandemic and how Dr. Moore has had to kowtow to Doug Ford and has changed his position a couple of times because you could see that he's an employee of Doug Ford, and Doug Ford really made a point to make him feel like he's an employee under Doug Ford.
I don't see this as being problematic. Margaret is very outspoken, and this is actually very well written. Any issues with it? Jocelyn,
I
you look a
think
little hesitant.
I'm just thinking about the reporting, like the structure of the, because I don't know enough like about like how arm's reach the CMOH is, and how like like I just don't understand like everything about that, really like
Are
enough
they?
about that relationship.
Because are they actually like? Sorry, what does it say that he is? Are they say that he's a deputy minister? Well, of course he's going to be a deputy minister because he's a bureaucrat.
Yeah, so I'm just not sure how independent, if like whether it's like kind of optics or the current relationship that we're looking at here between like that we've seen during the COVID pandemic, or whether that's like a result of the formal relationship. You know what I mean? That's what I'm thinking about.
A deputy minister is inherently nonpartisan because they're government, but they do have to but they do have to follow direction from their minister because there is a hierarchy. Whereas somebody who would be like an ombudsman or something would be different. But this isn't an ombudsman office. It is like a hierarchical thing.
Yeah, and I wonder about like
Is
like
he
the
actually considered a deputy minister though?
these are the things I need to look at. Like I thought they were kind of more arms, you know what I mean? Like arms reach, like they a little bit distant, and that they were able to speak independently based on their medical knowledge. But that's something I would have to look into to understand what it would mean for them to be independent of government. Is there anybody else in a similar role? Is that a reasonable thing to ask? Is that something that RNAO would be situated to ask?
Well, the chief nursing officer, she has come out vocally lately to say that she is a deputy minister who sits at all the right tables, like, and that she really is independent, able to speak.
Wait, what
So
did
I
you say,
don't
Hilda?
know about the chief medical officer. He's not a nurse, so like, yeah.
Hilda, I just didn't hear the one word you said. Did Dr. Lee Chapman, did she say she isn't independent or she is?
I don't know about Lee Chapman. I know that Kareem has been speaking in Ontario.
Okay.
I have not heard Lee Chapman. She's federal, so it might be a little different.
But did
I'm
she
not.
say she was independent or she was not independent?
Not sure.
Karima in Ontario said she is independent. She's a chief.
It's
Oh,
She is a
nursing
chief
officer of Ontario.
finance chief
Nursing.
minister's assistant minister. She is quite advocate about or adamant about being independent and sitting at the right tables. And she has said some very interesting things like that we have to be very creative now because we've never been in such a unprecedented situation where we need nurses so much badly, and the aging population is increasing by leaps and bounds.
I think that's really important information about Rob. I'm really worried about time and making sure that everyone just gets to see this last one as well, just so they can see it and then give feedback on it in one way or another. So maybe we'll just move to the next one. And it's a very long one, but it's about the call to action to advocate to the federal government and the chief nursing officer to allocate funding to the Canadian Association of Schools of Nursing, CASN, for the provision of educating nursing students to acquire positive coping strategies to develop their emotional resilience for their future professional practice. Well, the next one has, I'm just going to read the resolve, what they want. They want the RNAO to advocate the federal government and Chief Nursing Officer of Canada to allocate funding to the Canadian to CASN to develop curriculum to support educators in teaching nursing students to acquire emotional coping strategies to develop their emotional resilience. And that the RNAO advocates with the Ministry of Health of Ontario, Council the Coupon. Sorry, one second. I'm going to call.
basically whereas nurses eat their young.
Yeah, so they're asking for them to build in like basically self-care and coping strategies into the curriculum, which I think is a sad situation, honestly.
To be honest, I don't like this because I think the problem is the system is messed. So why are we trying to put the onus on the student to help themselves when we should really make the system more supportive of the student in the first place?
And maybe this isn't supportive of anyone. I think that's another theory here. A certain, yeah, regardless of the skills that you can somehow draw up. Any quick thoughts on this or anything? You can write in the chat too. And then I just want to quickly tell everyone who's here, because we've got a couple of new people, about some stuff that's going on, and then just so you can see the slide and I can share the links. So think about it. I'm going to grab those links for you. Okay, maybe we need a little more time.
I'm actually thinking I want to vote against this.
You don't think it's the right direction?
I think it's the wrong direction. I don't think we should be this is putting the onus on the student. It's not telling this. I think it should be resolved that the nursing programs support their students properly.
They turn on its head, like, so that they advocate for better working conditions, maybe, or or yeah, for
that they
students to
support
enter
that they're
safe places.
Holistically safe, holistically, like, teachers are kind of like nurses. Like, I know these are teachers and nurses together, but if you think of like a teacher in a school system, a teacher is supposed to care and nurture for their student. And nursing schools should be caring and nurturing their nursing students. Yes, we want them to be competent practitioners, but we don't want to make them competent by like doing this, like beating them to the ground, and whoever survives makes it through. We want to create some, we want to nurture them to be a good student, not beat the crap out of them, essentially. And Emma.
Rob, if I'm maybe hearing you correctly, it sounds like part of the issue that you might be taking with it is that this is not in any way addressing the root cause of why students would be experiencing these issues, and that it would be more of a band-aid solution. And as you put it,
than I am.
you're telling students, well, this is the work this is the work environment that you're choosing to go into. So it's your responsibility, and it's the nursing school's responsibilities to harden students, essentially, harden them up for a workplace that is not safe on a variety of levels.
Can you write that out for me? I can't take
No,
what
but
you
this
just
is
said.
recorded, so you can copy it down later. Once it comes out of my mouth, it's gone from my brain.
I
Yeah.
agree with you, Emma. This is like a Band-Aid solution rather than addressing the problem to begin with. I agree with you.
All right. Thanks, Emma. All
That
right. So
was
we've got some really
that
good
was
feedback
wonderful.
there. I feel the same way. I really don't feel like this is the right direction. I don't think it's, yeah, agree. Okay, and if anyone else has any comments, next we have this last slide. Thank you everyone for holding on there. I think there's some really interesting stuff here. We just don't have time to like really dive in deep enough, I think. But honestly, it wasn't too painful. Things happening in Ontario. I can't read all this out, but you probably know about the ministerial zoning orders and how land use has been a big problem in Ontario. And when we talk about the environment and the directions that we need to go for climate, for food security, for air quality and beyond, biodiversity, and a lot of land is being taken back, and powers to protect it by municipalities and regions have been deteriorating. So I just want to direct you to a couple of links here. I'm going to put these here. Oh my goodness, these come out very strangely. Okay, 1 second. I'm going to do them one at a time. So there's a petition that has, oh, 1 second. A petition that has come out. There's this cute little message here from that you might want to share. It's a Twitter child talking to government, and one of the conservative MPPs actually acknowledged that we should be protecting the Greenbelt. Okay, and then this Peter Tabuns is a petition regarding Bill 23 that has been updated because it, of course, has passed. And then there's these ACELA events, the Canadian Environmental Law Association event, focused in on what to do now about Bill 23 and the Greenbelt being changed, and like what can we do now, what's the situation now. So I've put those in there. That's the Markham link, that third link. So that's coming up June 15th. We've talked a little bit about Lyme disease. That's increasing. There's some media about that. And then just pointing you to a couple of great resources. The Alliance for a Livable Ontario, if you're interested in advocating further on issues of land use in Ontario. Not just land use, sustainability, health, and environment. The Narwhal has been a great resource for reporting on the environmental issues in Ontario. It has a tracker of how things have changed. It's hard to keep track of all the policy shifts. Environmental Defense is doing a lot of advocacy work and have action alerts, like where you can send letters. And CELA, of course, is doing this webinar. And they also have a lot of other great tools, information sessions. There are lawyers and people working in policy and law. And so they're an interesting group to go with. So just wanted to leave you with that before we left.
I have a follow-up question for you, Jocelyn, on that.
Yeah, sure.
There was last week a bunch of the farmers came out in opposition to Doug Ford's actions, and
Yes.
Doug Ford said he was going to change something.
Yes.
Which bill is he changing?
Okay, so my understanding that it's a specific piece, I think, of Bill 97. I think that's the one it is.
Okay.
It's related to the provincial policy statement in Bill 97, where they were going to allow for severances of agricultural properties, I think up to 3 or 4. So you could like cut off sections of agricultural properties. And then what the fear is and what is actually happening on those lands right now is that people are building very large houses, big landscape yards, and it's no longer being used for agriculture. So it's lost in essence, right? And so those farming organizations all came together and said, hey, I know you think that you're speaking for us, because Doug Ford kind of said, I've talked to farmers, they want places for their families to live. They want to be able to build houses for their own families, like farming families. But the farming organizations, even ones that are like run from the progressive to most conservative, some that are most often allied actually with the directions of the conservative government, they all came together and said no on this. So we actually end up getting an about face on that, which is has been rare with this government that they switched course. I'm not sure exactly how that's going to play out, that switching course, like if they've withdrawn it or totally, or if they're changing language.
So
Not
it's
yet
not
up to
built.
date.
It's not Bill 23. It's
No,
not the developers building on farmland. It's purely the severancing.
it's
So
the
they can still
severance piece.
sell their land to developers, but because a farmer can still sell their land to developers, correct?
Well, they do need rezoning, but things are becoming much more watered down. So if the ministerial zoning orders, which have been used multiple times, as it says here, like hundreds, and that's like unprecedented in our history, if they've been used, if that's used, then they can kind of force a zoning change. So yeah, like I think what's happening is municipalities are struggling because province is saying you don't have control over your zoning and your protection of different types of land anymore. You need to open these up because we need it for development. And there's a lot more to it, but I know we're running out of time, Rob. But maybe we could talk more about this. Like maybe we make sure, because I mean it's going to keep going. Maybe that's the focus of our AGM even, or yeah, I don't know how else we can talk more. Maybe
If anybody's
yeah.
really interested on this file, please take a lead on it.
Yeah, we really do need someone like honestly just keeping up to date because it gets complicated. So I've gone to a couple of different meetings, but I can't go to all of them. There's a few local ones and this alliance group, and then the OCEC is actually the Ontario Climate Emergency Campaign that RNAO signed on for. They have been connected to the Alliance for Livable Ontario in some of the work, so they're also engaged here too. All right, that's it. Well, thank you guys. I just wanted to leave you with some
Thanks.
actions and some things that are happening here in Ontario, and then some of us are going to meet up at the AGM. I'm going to join for the day on the actual AGM day for as long as I can. Rob's going to be there. Hilda's going to be there, yeah, thank you guys for sending Rob off with some good information and debate.
And if you
And
want
for
to
I've
joining.
email
never
me,
met you in person. It'll be a joy.
I know, right? I'm so excited for that. Oh, go to the next slide quickly, Rob. It's just the email address in case you don't have it.
an
And
email me like if you have more comments on this that you want something brought up and you considered in the vote, please email me and I will, yeah, I'll take
yeah,
that into perspective, please, because like people may not have had enough of a platform here. So if you want more of a platform, feel free to send it by email.
yeah, absolutely. Yeah. Thank you everyone for coming along. And I know it did run late. Thanks for holding on with us. And if anybody has missed any, at least we have it recorded. So we'll have this up as well. If there's anything you want to hear again or take another listen to a section, you got that recording to rely on too.
I have
All
one
right.
more question for Jocelyn. Where is this
Sure.
picture from? Is that from
Oh,
Kenora?
that's in like so a logged area north of Kenora, basically where we went moose hunting
That's so
at
cool.
sunset. So it's like nice to end a presentation with a sunset. Although it's long gone now. Actually not long gone. Summer's on its way. All right, you guys, thank you for coming to the June meeting. We'll have another AGM, but if you want to be more involved, you can always email us with this email address here for anyone listening to the recording as well. And you can get connected with some of our work, like day to day, week to week. We'd love to have your energy. And we also have a call for nominations out right now. So please respond to that as you
And
see it in your inbox.
if you want to take your environmental advocacy in a certain direction and you want to join, let ONEIG be that platform for your environmental advocacy, and we'll try to work with you in that. So if you like, so so Nancy and Sarah are still here. If you want to do something, please, like, we can support you in where you want to go with it.
Yeah, absolutely. Like we're really, here for you. And to move in the directions that our membership wants as well, because there's so many places to go. Oh, and also like we did have minutes from the last quarterly meeting, but we did have a tech glitch. So what we'll end up doing probably as a executive is just approving those minutes by email. Because it was just us that were able to attend. So I'm glad you made it out tonight. Good night, everyone, and thanks again for joining.
Thanks.